Hello, I'm Mike Spence. This is TSPN TV, News in Depth, and I'm here today with a special guest, Ann Platt, who is the CEO of Sutter Amador Hospital. And we have been interviewing over the years, and this is great to be able to get an update as to what's happening over there at Sutter Amador Hospital. And there's always something new and exciting going on. Why don't we begin by discussing some of the newest recognition that you've been receiving in terms of awards and things like that.
Okay, Mike. Well, it's a pleasure to meet with you again, and I'm always happy to talk about the hospital and some of the wonderful things.
Yeah, let's get right into it. There's so much going on over there, and we have a good amount of time that we can really get into some detail.
Yeah. Well, we have a lot of new initiatives around patient care and quality best practice standards, which I'm really proud of. We have very dedicated clinical staff. We've been awarded several grants through the Moore Foundation because they see that Sutter is committed to quality, and they have helped support some very innovative initiatives. So, for example, we have been working with best practice in sepsis care and have provided a lot of training and established protocols to assure that when a patient arrives at the hospital with that life-threatening condition, that everyone knows to immediately call a sepsis alert and give that patient everything that they need at the right time and with the right medications. So that's been a very exciting program for us, and we have been recognized in the recent past. The IHI, the Institute for Healthcare Improvement, invited one of our critical care nursing leaders to a conference in Florida to present a presentation about how we partner with the ambulance service for early identification of sepsis patients and early implementation of the protocol right there in the ambulance. And that's very innovative, and so we were recognized for that.
You're always getting like a grade A for safety. I read all the time about all the different accolades.
We strive for that. Again, we're a small hospital, so we don't always get rated on everything that all large hospitals would be rated on, so sometimes we're excluded for that reason. But we strive to be grade A in everything we do. We also have a hospitalist group that are internal medicine physicians who take care of patients in the hospital, and they've been recognized twice now, 2 years in a row at a national level in their company for excellence and strong teamwork.
How do you manage to attract all these great physicians to Amador County?
Well, Amador County is such a wonderful place to live.
You know, it's a very small market to be able to get some of these great physicians. I know we have new surgeons and a lot of new doctors that are coming over.
Well, recruiting physicians is very, very difficult, especially to a rural community. So what we have found is that if we look for a group that has access to physicians and can employ physicians and has a good reputation, they are able to recruit physicians who would like being at Amador. So we've been more successful with that approach than trying to put an ad out for an individual physician to come to Amador County. And so with the hospitalist group, we contract with a national company called Sound Inpatient Physicians, and they have hired really excellent board-certified internal medicine physicians who rotate on and off the schedule. So they like that flexibility with having, say, a week off and then a week on. But they all work very well together as a team, and they've been recognized for that.
I know that Sound Inpatient group because I've paid my medical bills there. I had a few incidents. And
you've had your own experiences,
I had my own experiences over the
yeah.
last year or so. And going in, I have to say that Sutter Amador is probably one of the most personable, comfortable places to be, I would imagine, in terms of all the other hospitals, in terms of being cozy and warm and friendly. It really is a great place, but the emergency room has really expanded. And I know that that was a big part of changes over the last few years.
We did. We more than doubled the size of our emergency room, and it's a good thing we did because I've been at Sutter Amador now for 10 years, and we've gone from seeing about between 10 and 11,000 patients a year to 20, and this year we will exceed 20,000 in a year. So we really have needed that additional capacity, and we have a good emergency room group as well. So we contract with a group, and they have recruited and hired physicians to staff our emergency department.
I've been in there a few times, and
yeah, I'm sorry.
They always make you feel like you are the only patient in the place. I know that there have been a lot of changes and talk about new structures. Is there a new infusion center that's being built? What are some of the new things that are being built at the hospital?
Yeah, I'm glad you asked. We have a few new things going on. You asked about the structure. Sutter Health, as our parent organization, has restructured recently from a 5-region structure to a 2-area structure. So we are, as Sutter Amador, part of the Sutter Health Valley area, which includes all the hospitals we've been affiliated with in the Sac Sierra region, plus the Central Valley, Modesto Memorial, Sutter Tracy, and Sutter in Los Banos.
So when they say Sacramento Sierra region, that includes part of the valley too?
Well, we're no longer Sac Sierra region.
So it's
we're
changed.
Now a corporate entity called Sutter Health Valley Area, which incorporates two of the previous regions. And the other half of the company is called the Bay Area. So we have the Valley Area and the Bay Area. And they are very similar. They are sort of mirroring each other in terms of the organizational structure. So we've gone through this redesign and restructuring to focus more on the patient experience and standardizing that experience for patients, whether they're seen in Amador or San Francisco or Modesto or Sacramento.
There's always been a need for certain specialties to drive all the way to Sacramento to get care, an hour and a half to 2 hours of driving. But some of the new facilities at Amador would allow people to stay in the county and get a lot more services. And the infusion center, I think, is one of those types of resources
that will be very
that
exciting.
would be incredible.
It's a very exciting project. We are in the planning stages right now. We received a very generous donation from the Spente Foundation.
It was quite generous.
It was fabulous. We're so grateful to them. And they announced that earlier this year, and we had a matching grant with Sutter. So if we raise $600,000 from local community donations, Sutter agreed to match it. And we thought it would take quite a while to do that. But with the Spente Foundation announcing their gift, we had an amazing outpouring of generous donors, and we have exceeded that target already this year. So we have $1.2 million to fund this new cancer chemotherapy infusion suite in the outpatient building. We just need to get the plans finalized. We've invited patients into our planning process, patients who have had to go outside of the county for chemotherapy, and they've helped us modify our design based on their experience. Because again, we want our services to really maximize and enhance our patients' experience of the care.
And you have a professional architect putting this all together.
Oh, absolutely.
A designer. This isn't just putting up a few
walls.
No. This is going to be a really special
it's going to be beautiful.
Comfort zone in terms of the view and having people be able to be as comfortable as possible in a very serious situation.
Absolutely.
And there's such a need in Amador County. You probably wouldn't say the number, but I know that there are probably about 70 identifiable patients who have to take that drive all the time to Sacramento.
How did you know that was a number?
That, huh?
Yeah. No, we did hear because, a lot of our patients go to the Sutter Infusion Center either in Roseville or Sacramento, and there are about 75 patients.
Identifiable ones. There are probably a lot more.
Yeah, there are probably more that are going outside of the Sutter system. Yeah. So we're very excited. I think I don't have a timeline yet, but I'm hoping that we will begin construction early next year and be ready to receive patients before the end of the year.
Sorry to get you talking about something that's still in the process.
Yeah, no, but it's very exciting, and it's made possible because of the generosity of our community.
Well, we're going to come back and we're we're going to talk about insurance after the break. Before we do, we should say that I think that's the biggest reason why people donate to the hospital, is that they're able to see these specialized programs and special equipment and everything, and they know that their donation is going to go to the local facility versus
Right.
into the broader general fund at some other hospital
Right.
facility.
They all stay here to
That's very
benefit the
unique here.
community. Yeah.
In Amador County, because you've had different programs that you've been doing matching donor programs for, and that infusion center is just about, that's an exciting thing.
It is. It's very exciting.
And we see that the days of having to drive off to Sacramento hopefully are long past, and people can stay here in Amador County for a lot of their needs and resources. And we have a lot of questions to talk about, and I've got a whole list of things we can go over.
Great.
We're going to take a break here shortly, but we want to make sure that we cover, insurance and some of the new technology that you're offering there at the hospital, and all of that surgical. I want to get a plug in too before we go to break for Melody in the surgery
Melody
department.
is wonderful.
She is
Yeah.
just, Melody Montgomery, doing an amazing job, and I'm hearing nothing about, Dr. Melanchek and all the great things that he's doing. But when we do go to break, please stay tuned afterwards, because we want to talk about how the insurance things have changed and policies and things for coverage for everybody here in Amador County. And probably, I haven't been on this desk for a while. Are we going to break here at some point? Tommy, let me know. Okay. Please stay tuned.
Are we?